cancer. This does not just affect families and sufferers emotionally, but it can also take its toll on their finances as well. It is traumatic enough to see a loved one fight the disease or even lose the struggle. Families should not have to deal with mounting bills in these dire times. According to Old Mutual Greenlight statistics, cancer was the largest or had the largest number of claims in the big four illnesses such as heart attacks, coronary artery bypass, as well as strokes that was paid out in 2015. Joining us this morning from our studios in Cape Town is Dr. Peter Bond. He is the Chief Medical Officer at Old Mutual. Dr. Bond, good morning to you and welcome to Morning Live.
Good morning, Palisa.
Thank you so much for coming through, Dr. Bond. Now, according to your stats, over 3 billion rand was paid out in claims in 2015, and 57% of those funds were claims made for cancer patients. Talk to us about those numbers.
Well, we found that over the last number of years, the number of cancer claims have been increasing quite significantly. And we see that particularly in the severe illness benefits that we offer, where the big four that you mentioned, heart attack, stroke, coronary artery bypass graft, and cancer are the main contributors to the claim statistics. The increase in the amount of or the number of cancer claims seems to correlate very closely with the diseases of lifestyle that we're now seeing, which are reaching epidemic proportions and in fact are going to reach even more epidemic proportions in the future.
Yeah, and I suppose the main question here is the questions that people should ask or need to ask before they could get that health cover.
I didn't get the question.
Yeah.
The questions
what are
that
the
people
questions?
need to ask.
Yeah, the questions that they need to ask before they get that health cover.
They need to understand their own family history. They need to understand their own state of health. Yeah. They need to look at having regular checkups with their practitioners. They need to be able to understand the nature and the cause of these severe illnesses, and particularly cancer, because a lot of it, in fact, is preventable. So they need to answer those questions before they seek cover.
And can early diagnosis maybe help in terms of getting the right cover for cancer?
The right cover for cancer, well, there are the primary line of defense for any severe illness is obviously your medical aid. But you really need to be able to speak to a financial advisor who can advise you on what types of products are the best suited for your particular needs. And it's quite important for people to take care of their financial health, because the costs of these severe illnesses can be quite extreme and cause quite severe hardship for families.
Yeah, it does, because I also wanted you to give us a rough estimate maybe of what treatment of cancer can cost. We know there are chemos involved and so on.
Yeah, well, it depends which type of cancer we're talking about, and obviously at what stage one catches the cancer. First of all, you need to be diagnosed, which in itself can be quite expensive. And secondly, the treatment will probably take the form of surgery, will take the form of chemotherapy, and maybe even a combination of chemotherapy and radiotherapy. That's going to require hospital visits, hospital stays, intensive care units. So we're looking at tens of thousands, sometimes even hundreds of thousands of rand that it can actually cost you just in direct costs. A lot of that is obviously covered by the medical aid, if you're on a medical aid. But there are a lot of indirect costs as well, which we don't initially think about. And that's usually in the recovery phase, that what I'm talking about here. It's costs related to adjustments to your home, to adjustments to your lifestyle that are not going to be covered by your medical aid. And a lot of these severe illnesses are also accompanied by significant psychological problems, which will require therapy and probably ongoing therapy, which may not be covered by your medical aid, or certainly may be limited by your medical aid. So we're talking here tens of thousands to hundreds of thousands of rand, depending on which type of cancer you have.
Yeah, and it might be quite a burden on your family if you do not have a medical aid, I believe. But there are public hospitals that still have cancer treatment.
Yes, there are. Medical aid will obviously be your first line of defense if you do have one. But what's quite important, it also takes you away, if you're the breadwinner, it takes you away from your ability to earn as well. So you need to consider that. If you're a small business owner or you're a sole proprietor, you may not have the backing of a company to support you while you're ill. So you need to think about income replacement as well, because the recovery from cancer can sometimes be quite lengthy.
All right, Dr. Bond, thank you so much for talking to us this morning.
It's a pleasure. Thank you.
All right, thank you very much indeed. There you have it. That was Dr. Peter Bond. He is the Chief Medical Officer at Old Mutual. He spoke about the importance of a proper healthcare cover for people who suffer specifically from cancer.